name is Jack McCarthy with the Somerset West Community Health Centre in Ottawa, and I also chair, at this point in time, the Canadian Alliance of the Community Health Centre Association, CACHCA.
And why are you excited about this upcoming conference in Toronto?
I'm thrilled about the conference in Toronto. I think an opportunity that's going to bring folks together from the United States and some Mexico, potentially Latin America and Western Europe and Australia, bringing folks together who are passionate about how to provide comprehensive primary health care, I think is an exciting opportunity. I'm thrilled to be a part of it.
And for American delegates, I mean, we think that the American system is very different, but in fact what I'm hearing is that there's a lot of commonality in terms of issues.
Oh, absolutely. And talking to a number of certainly American delegates here in the Dallas conference, I'm hearing for sure that many of the issues that our CHCs face are the issues that we have in common. It's how to connect with vulnerable populations in the best way, how to deal with the social determinants of health, how to ensure that we're providing quality health care to the populations we serve. I think there's a tremendous amount of stuff we can learn from each other.
Mm-hmm. For Canadian delegates, what do you think they'll get out of it the most? What do you think? What are some of the specific things they may learn?
I think there's a lot we can learn as Canadians on the quality agenda, because I think the number of the CHCs in the States, I think are really are leaders in how are we counting the right stuff to make sure that we are making a difference in the communities we serve. So I think in the research side and certainly on the quality agenda, I think there's a lot we can learn. Because I think CHCs in the U.S., because they have the insurance challenge, they have high volume primary care practices. So they've had to be really efficient and effective in how they provided services to their population. So I think as Canadian CHCs can learn a lot of how they provide primary care in the most efficient way.
And for American delegates, what do you anticipate they might be most interested in coming to Canada?
Well, from some of the discussions I've heard, I think how we build healthy communities. If we still have access issues in Canada, for sure. I think some of our American friends think that we've solved that problem. We've solved the insurance side of the issue, but for vulnerable populations, we have a lot to learn and a lot to grow and develop as it relates to how we provide the best possible services to that population. So I think for American delegates coming up, I think how we address the social determinants of health, how we build healthy communities, how we collaborate intersectorally with people in the housing sector, education, criminal justice sector, social services. I think they're going to be interested in that, but they have some stuff to certainly share with us as well.
And then the international part of it is also very interesting, people coming from all over the world.
Well, I think that's tremendously exciting, and I think certainly from folks talking with folks in Western Europe and in Australia, New Zealand, they're struggling with the same kinds of questions about social cohesion and building civil society and the role that community health centers can play in local communities, building healthy local communities. So I think there's tremendous excitement we'll build, bringing people from all around the world who are asking the same questions about comprehensive primary health care.
Yeah. Now, Jack, we know you're from Ottawa, but tell us why Toronto is a great place to visit.
Toronto is an absolutely wonderful place to come. Love Toronto, and certainly the network of CHCs in Toronto are an absolutely exceptional group of community health centers, very diverse, very different in responding to their different communities. So I think it's, the most multicultural city in the world that has so much to offer, and in terms of how local communities own the solutions to local problems. So I think we'll be thrilled in Toronto with what the CHCs there have to offer at this conference.
And there's other fun too, right?
Oh yeah, there's lots of fun, and I think the challenge is how we can have some parties and visit CHC sites for sure, but have a really, really good time, because as one person said, if you can't have some fun and doing some dancing, then often those meetings aren't worth having. So.
Okay, thanks very much. See you in Toronto.
For sure.